Hey guys, welcome back to Minus Breaks. This video is gonna be the most important topic of my YouTube world because it's all about pregnancy. The complete thing you'd be seeing, the complete procedure, the preparation, the mental awareness, the physical awareness, the food you need to consume after birth, before birth of a baby, even the partner, as a husband, what you need to think, you need to be ready about all these things, many things, many things which this generation never learned and they just suffer after getting a baby. So I just thought to do this video in 2-3 parts. Let's see how this video goes. So with that, I'm starting this video. So what is pregnancy? Pregnancy is a process in which a fertilized egg develops into a fetus inside a woman's uterus. It is typically lasts around 40 weeks, that is 9 months, and is divided into 3 trimesters. During this period, we undergo significant changes to support the developing baby. So before knowing about the pregnancy, let's see the history of pregnancy and childbirth practice. In ancient Egypt, women used barley and wheat fertility tests urinating on grains to determine pregnancy. Greek and Roman civilization had midwives assisting with births at home. Many cultures had herbal remedies to aid pregnancy and labor. In medieval and Renaissance period, childbirth was mostly handled by midwives. Superstition and religious belief influenced pregnancy practice. Pain relief was minimal and maternal mortality was high. And in 18th and 19th century, the medical field started recognizing pregnancy as a science, and the discovery of germs by Louis Pasteur led to better hygiene in childbirth. Hospitals started assisting in delivery, but many women still gave birth at home. And 20th century and modern era, advance in medicine, ultrasound and prenatal care improved pregnancy outcomes. Epidurals and C-section became common options for safer deliveries. IVF, in vitro fertilization, was introduced, allowing couples with fertility issue to conceive. Awareness of mental health during pregnancy increased with support for postpartum depression. So what are the early signs and indications of pregnancy? Symptoms vary for every woman, but the most common early signs include missed periods, nausea, fatigue, and breast tenderness. First comes missed period. If your period is late by a week or more, it could be a sign of pregnancy. Some women may experience light spotting instead of full period. Comes nausea and vomiting, that is morning sickness, starts around 4 to 6 weeks of pregnancy, can happen any day of the day, can happen not just in the morning. Severe nausea, that is hyperemesis gravidae, may require medical attention. And next, it's all about fatigue and extreme tiredness. Hormonal changes increase progesterone level, making you feel exhausted, can start as early as 1 to 2 weeks after conception. It's all about breast tenderness and swelling. Breast may feel so fuller or more sensitive due to hormonal changes. Nipples may darken and veins may become more visible. And next is all about frequent urination. Increased blood flow to the kidney makes you pee more often, starts around 4 to 6 weeks of pregnancy. And next, food carvings and aversion. Sudden carvings for certain foods, stronger dislike for foods you used to enjoy due to hormonal changes. That is emotional changes due to pregnancy, hormones, estrogen, and progesterone. You may feel happy, sad, or and next, it's all about mild abdominal cramping and bloating, similar to period cramps but lighter, caused by uterus expansion and increased blood flow. And next, it's all about metallic taste in mouth and increased saliva. Women report a metallic or strange taste in their mouth. Extra saliva production may occur in early pregnancy. And next, it's all about dizziness and lightheadedness due to lower blood pressure and increased blood flow. So how to confirm pregnancy? First, you need to get home pregnancy test, that is HPT, can be taken after a missed period for accurate result. Detects HCG, that is pregnancy hormone in urine. And next, it's all about blood test, that is HCG test, more accurate than home test, can confirm pregnancy as early as 10 days after conception. And next, it's all about ultrasound scan, that is confirms pregnancy and checks baby's heartbeat around 6 to 8 weeks. So what are the foods to avoid in early pregnancy? That is papaya and pineapples may cause uterine contraction. Unpasteurized dairy, soft cheese, risk of infection, and excess caffeine soda can affect baby's growth. Raw or undercooked meat and seafood, risk of bacteria and parasite. And next, the most important, hydration and healthy drinks prevents dehydration, nausea, and helps in nutrient absorption. Best drinks: water 8 to 10 glasses daily, coconut water, naturally electrolyte, fresh water juice without sugar, milk and butter. And most important, avoid caffeinated drinks such as coffee, cola, and alcohol. Same way, fiber-rich food prevents constipation, that is keep digestion smooth and prevents pregnancy bloating. So So best sources are whole grains, that is brown rice, oats, whole wheat, and fruits like apples, pears, and bananas. Vegetables like carrots, beetroots, and cucumbers. Nuts and seeds like flax seeds, sunflower. Avoid refined foods like white bread and junk food. It's all about iron and calcium foods for blood and bone health. Iron prevents anemia and fatigue. Calcium strengthens baby's bones and teeth. And same way, you need to have dairy products like milk, cheese, yoga hut, and green vegetables, spinach, methi, drumstick leaves, and savory dry fruits like figs, dates, and raisins, and iron-rich foods like lamb and meat, lentils, and tofu. And take iron calcium supplement as per doctor's advice. And have protein-rich foods for baby's growth, builds baby's muscles, tissues, and all. It's all about eggs, rich in choline, essential for brain development. Fish, low mercury fish like salmon, dairy products, milk, yogurt, paneer, nuts and seeds, almonds, walnuts, and other seeds. Avoid raw meat, raw egg, and high mercury fish like shark and swordfish. And have folic acid rich foods, prevents birth defects, such as essential for baby's brain and spine development. So, leafy greens, spinach, kale, broccoli, citrus foods like orange, lemons, legumes like lentils, chickpeas, and beans, and also take folic acid supplements 400 to 600 mcg daily as prescribed by your doctor. So, eating the right foods in the first trimester, 0 to 12 weeks, is important for baby's development and mother's health. So, what are the things to be aware of before getting pregnant? Preparing for pregnancy is important for healthy mother and a baby. Before conceiving, focus on physical, mental, and financial well being to ensure a smooth journey. First, health and medical checkup. Preconception checkup, visit a gynecologist to check overall health and fertility. Have blood tests, check for iron, thyroid, diabetes, vitamin deficiencies, and infections. And same way vaccination, ensure rubella, hepatitis B, and tetanus vaccines are up to date. And if you have a health condition, PCOS, thyroid, diabetes, BP issues, manage them before pregnancy. And next, it's all about folic acid and prenatal vitamin. Folic acid 400 to 600 mcg daily helps prevent birth defects in the baby. Start prenatal vitamin A at least 3 months before conception. Check for calcium, iron, and vitamin D deficiency. Next, it's all about healthy lifestyle diet. It's all about heat, nutrient-rich foods such as fruits, veggies, whole grains, dairy, lean proteins. Maintain healthy weight. Being underweight or overweight can affect fertility. Stay hydrated. Drink at least 8 glasses of water daily. Limit caffeine intake, that is maximum 200 mg per day. That is 1 cup of coffee. Avoid junk food, preservative sugar, alcohol, and smoking. And same way, it's all about track ovulation and menstrual cycle. Understanding your fertile widow, it's all about improves pregnancy chances. Use ovulation kits or fertility apps to track your cycle. Have regular intercourse every 2-3 days during the fertile period. Regular periods may indicate hormonal issues. Consult a doctor if needed. And same way, exercise and physical fitness. Engage in moderate exercise like walking, yoga, and swimming. Strengthen pelvic muscles with Kegel exercise for a smoother delivery. Avoid exercise, workout, or sudden weight loss programs. And same way, mental and emotional readiness. Pregnancy brings hormonal and emotional changes. Be mentally prepared. Reduce stress through meditation, deep breathing, and or jog your parent about parenting responsibility and expectation. Avoid overthinking or unnecessary stress about pregnancy. And next, it's all about the most important financial planning. Pregnancy and delivery can be expensive. Please note about the medical cost, hospital expenses, and baby essential. Check if you have health insurance that covers maternity cost. Start saving for future natal and postnatal care. Avoid last minute financial stress by planning early. Next, it's all about avoid birth control and detox your body. If you're on birth control pills, stop them at least 2-3 months before trying to conceive. Avoid smoking, alcohol, and recreational drugs. They affect fertility. Detox from harmful substance before pregnancy. And next, it's all about genetic testing if needed. If there is a family history of genetic disorder, consider a doctor for screening. Common tests include thalassemia, sickle cell anemia, and chromosomal abnormalities. The most important, be patient and stay positive. Conceiving can take time. Don't stress if it doesn't happen immediately. Maintain a positive mindset, healthy lifestyle for the best result. If conception takes over a year or 6 months for women over 35, consult a fertility specialist. So proper preparation before pregnancy ensures a healthy and stress-free journey. So think about all these things, so that your pregnancy time would be the best. So once you know you're pregnant, first you need to confirm pregnancy. First, doctor visit is needed. Take a home pregnancy test and visit a doctor for confirmation. And start prenatal vitamins as prescribed and have diet and nutrition. So mid-late pregnancy preparation, that is second and third trimester. So regular prudential checkups, that is monitor baby's growth on mother's health, take necessary tests, ultrasound, glucose screening, and blood pressure checks. And same way, exercise, do safe exercise like walking, stretching, or prenatal yoga. And birth plans and hospital preparation, choose a hospital and doctor for delivery, learn about birthing option, that is normal delivery or c-section or epidural, etc. Pack a hospital bag with essential clothes, documents, baby items. Arrange postpartum care and support. Learn about breastfeeding and newborn. Proper preparation ensures a safe and healthy pregnancy, reduce risk, and making the journey smoother for the mother and the baby. Let's see the stages of the pregnancy. Here comes the early pregnancy preparation. That is first trimester, 1 to 12 weeks. Once a confirmed, several steps must be taken to ensure proper care. First doctor visit and prenatal checkup. The doctor will confirm pregnancy through ultrasound and blood test. A due date would be estimated based on the last menstrual period. Routine tests include blood pressure, urine analysis, and screenings for diabetes and infection would be taken. All about mid-pregnancy preparation, that is second trimester, 13 to 27 week. This is considered the most comfortable phase of pregnancy. The baby's movement becomes noticeable and preparation for delivery begins. So regular checkup and scans will be started. That is ultrasound scan around 18 to 22 weeks to check baby's development and gender, and same with screening for gestational diabetes and monitor blood pressure and weight gain. And same with physical health and exercise. Engage in moderate exercise such as walking, parental yoga, and light approaching, and wear comfortable clothes and supportive shoes to reduce back pain. So often your partner need to care about your emotional thing, all these things must be connected, only then the proper pregnancy would be happening. So preparing for baby's arrival, start setting up baby's nursery research, baby essentials such as cribs, stroller, diapers, clothes, etc., which you need to give. And late pregnancy preparation, third trimester, that is 28 to 40 weeks, that is the final stage of pregnancy. Focus on preparing for labor and delivery. First comes regular prenatal visits, weekly checkups to monitor baby's position and mother's health. Growth scan to around 32 to 36 weeks to check fetal development. Doctors may discuss labor inductions or C-section if necessary. So preparing for labor and delivery, learn about labor signs, water breaking, contractions, and discuss pain relief options like epidural, natural technique, etc. Create a birth plan such as hospital choice, delivery method, support person, etc. Prepared. So everything be prepared. As a partner, you need to support your pregnant wife, so be prepared about all financial things before the pregnancy.
So right now I'm ending the part 1 video. On part 2 video you would be seeing the type of pregnancy and other important details. So with the thought on this video, take care, have a great day.